Good morning. Thank you for being here and being patient for our technical difficulties, getting everything up and going, limited time. I'm Erin Wick, and I'm the Senior Director of Behavioral Health and Student Support at ESD 113. And with me today is Tammy Woodard. Tammy, would you like to introduce yourself?
Yeah, I'm the Professional Learning Coach of MTSS with ESD 113.
And then JP, can you introduce yourself?
Yes, my name is JP Avila. I'm the Digital Communication Specialist with ESD 113.
Thank you. Next slide. So what we know, of course, we all know this, and I'm going to go through these slides a little faster since we're a little bit behind schedule. So we know that we need to look at behavioral health as a full system of care within schools. And so this, of course, you'll have these slides. This data is informing the process in which we have been trying to deliver comprehensive student assistance programs. We know that 5% of students nationally that need mental health care are actually getting it. So we do believe that the best way to do that is this comprehensive student assistance approach in which we've deployed in several of our districts in ESD 113's region. Next slide, JP. I said that one, so next slide. Our comprehensive student assistance program is built in a multi-tiered system of support. So over the last, I would say, 7 or 8 years, we found that schools, of course, understand multi-tiered systems of support, and we tried to put our behavioral health system into something so that we could have a shared language. So for us at 113, this looks like talking about our prevention services in a tier 1. Those are our school-wide practices. Tier 2 services are those students in which we're deploying direct interventions and some supports around that. The difference between a traditional student assistance program and ESD 113's deployment of student assistance programs is because we're also a licensed treatment provider, which allows us to also serve those students who are in tier 3, which for us, being able to access students so that they can reduce the barrier of being able to find care outside the school walls has been critical. Next slide. You will never be able to read this from where you are, but we wanted to put it into the slide deck so that you have it. This is always an emerging document for us. So it is our roadmap. So it gets into a little more detail on each of the tiers in which we just talked about. And then, of course, within those are the pockets of things that we're doing with school leaders and staff, things that we're doing within the school culture. Whoa. JP is testing me. The pieces of the work that we're putting into community-wide practices and families, as well as then, of course, the direct services to students. So think of this as a full system model. And we do know that when we talk about communities, our students, their communities are the schools. And so we really try to build the foundation around the school, but also engaging our community-based providers, including mental health, dental, physical health, and all of those things. So we're continuing to refine the model, figure out what works. Of course, the pandemic had some really interesting impacts on us as we were able to launch telehealth and try to figure out how best to deploy those types of services into our regions where we may not have staff to implement this particular model. Okay, next slide is our video that JP and communications team did a fabulous job. And so the important thing to mention about the video is that we didn't give a script to these staff. What we did was we went out and we just did an interview about the services in which we have in their districts and what they thought about those services and how they're going in their school. So I hope you enjoy this video, and I will let JP play it. We hope it'll play. I have faith in JP.
Jackie.
I can see it.
Education systems are full of
I can hear it.
inequities. And depending on where you're at, you either have access to services which are really robust, like here in Rochester, or you have accesses to services which are really complicated to gain.
I think it started with a goal of having access for all students.
Not just the school, it's the community as well. The system of care, it's the other providers, it's the behavioral health, it's the physical health, it's community resources to getting them food and benefits and all those sorts of things and how they go together.
What I've been really pleasantly surprised by is the level of collaboration and communication that happens between this program and our school counselors and the school administration.
We continue to learn and grow and change and adapt because we know we can do better than we've historically done for our kids.
Typically, when a student needs extra care at school, they rely on their school counselor, and that's a team of one.
It's just about building a network with the community. You know, we live in a world where everything's constantly changing. There can be someone that lives in the community that may not know of a new resource that's available.
We meet kids where they're at and really doing that in a way that is thoughtful, planned out, intentional, and not just a drop in. We don't just come to a school to do a service. We are embedded in that school to be a part of it.
Having Will on the team with his expertise has been so helpful.
As I start building relationships and people start to understand how our program works and how we can offer the support to these students, we kind of really open this this collective of collaboration with the school and families and with us.
It freed up their time and the amount of ongoing support they can provide to kids within our system.
When we have these additional services in the school, that also helps to provide them with care when they need it, as well as where they need it.
And for the students, by being there and building that rapport with them means that they'll just stop in and say, hey, I have a need, and they know that you're there. But you don't do that by just putting up a flyer. You do that by being seen in the hallways, by showing up at events, at evening events, or those sorts of things.
Relationships build trust. And when someone trusts someone, they feel safe. And when someone feels safe, they feel the ability to open up.
This is part of what we have here, just like we would have a PE teacher and an art teacher and a principal. We also have mental health support and substance abuse support within our schools. It's just part of a typical school for them.
And it reduces the stigma because now, again, it's not being walked down the hall or having to check out of school to go do this thing. It's just the thing you do.
Trying to just beat the stigma of like mental health and what that really means for young people and understanding like we all go through something.
As a school counselor, I don't have the time, right, or the resources or the current training that our systems of care providers have.
I'm just grateful that Rochester is one of the schools that has this program.
It's been a really cool program because it gives those youth who might need a little bit more attention or a little bit more time just to be able to sit and process.
I'm really trying to be a little preventive instead of reactionary. So when a student does misbehave, it's more digging into what is going on.
They have the knowledge of many more resources than I had been aware of and connections with the larger community.
We might know some of those pieces, but James has been integral, I think, in being able to connect our students and families with additional services, that kind of that wraparound piece that we just don't have.
Well, I think when it comes to having like other needs met, I feel like there's that piece where I feel like I'm definitely contributing to the students and their families. And so it is our job to really stay up to date with those resources.
And so, yeah, word gets out between kids and between families.
It is. It's their peers bringing them in. They are, kids talk to kids.
Trying to normalize that and trying to get to a sense to where we can just openly talk about that has been really, really, really cool.
I think as a society, we are getting better about talking about the importance of mental health. What I can say about youth today is that they really care about each other and they have high levels of compassion, and mental health is important to them.
Despite how high-tech kids are. They are craving personal, in-person contact.
These are the kids who don't have a lot of support, and these are the kids who just really need someone there for them, and that's why I enjoyed that side of the program. Yeah,
We're talking about a community of care.
It's become so part of us that we forget how fortunate we are, and it makes me just really want to advocate for these types of services to be available to all schools.
Schools like Rochester have given us such a great opportunity to pilot programs to try to learn how to do things better, so that once we think that we have it right, like we think we have now, we're able to really scale this up in other regions.
Every school system deserves to be able to go and access services for every kid.
I think this model is very beneficial and should be considered to be implemented across the state and, maybe across the nation, but that's a much larger thing we have to look at, right? But I definitely in our area, there's no sense in not having a system like this in every school, or at least every school district.
So I think the video really highlights the heart and soul in which we're deploying these comprehensive student assistance services out into our regions. And again, a lot of the foundation of this is really built on the collaboration. So, and that includes our communities, our coalitions, our schools, and then the direct service staff. I really want to highlight the fact that we don't believe that that there's one person that needs to be doing these services in districts. It does not need to be an ESD or a school district. What we're trying to do is create a model that works to access good quality care for adolescents. And that could be a community provider, it could be a school district, it could be an ESD, it could be a private provider. But really having a roadmap as to how to drive services out in a comprehensive and quality way. Historically, we've taken adult service models, community-based models, and tried to apply them in schools. But we know that using this model that is prevention through recovery support oriented is critical in really making the biggest impacts. And of course, that prevention and early intervention is so important for our kids. What we know is that students generally will suffer with a behavioral health condition for about 10 years before accessing care. So if we can do a better job of prevention and early intervention, we think that we can kind of stave off some of those issues that students are having to deal with before they need that tier 3 more intensive care. Next slide. I think I have 4 minutes. So some of the thumbnail just impacts of services using the data is we see about a 40% reduction in alcohol use, a 45% reduction in binge drinking, and a 40% reduction in marijuana use if implemented with this comprehensive system of care in our schools. We're also seeing an average of about 36% reduction in school suspensions and a 22% reduction in arrests. We work closely with our juvenile justice partners, and so that's also critical to think about as you're building these programs. And I think that's probably the last slide. Oh, no, there we go. Student behaviors. 39% of participants report that they're more likely to attend school because of these services. We had one parent tell us when we were filming a different video that really his son did not want to go to school on several occasions. And a lot of times he'd start with, will you just go and check in with Izzy? Just go and check in with Izzy and make sure that, that you have a touch point. And a lot of times him just getting into the school to meet with Izzy for a few minutes helped him be settled and set him up for success to actually attend classes the rest of the day. And then 89% of our kids report that they're glad that they participated in student assistance services. So that's pretty powerful when we're talking about the adolescents having these kinds of concerns, but they're finding this is a safe landing zone. They're building relationships. The staff are part of their system within the school. And so, yeah, so it's kind of exciting stuff. Tammy, anything to add?
No, I think you did a great job. I will say I've put several times in the chat my contact information since this is a quick session. So if there are any questions, feel free to reach out to me at that email.
You can reach out to myself as well if you want some additional information on direct behavioral health services in the 113 or in all ESD regions. We've got a network of us working on these models and implementing in various levels. So we're really thankful that you participated with us today.